The two most common side effects of radical prostatectomy are erectile dysfunction and urinary incontinence. Nerve injury during surgery is one of the primary causes, which is why avoiding injury to these nerves is a critical part of the procedure. There are two sets of nerves involved in erectile function and urinary continence: autonomic nerves and somatic nerves. The autonomic nerves are responsible for the initial phase of erectile function by increasing the blood flow to the penis and producing a partial erection. The somatic nerves are responsible for the critical second phase of erectile function and urinary control. They control muscles in the pelvis that allow you to voluntarily hold your urine, and muscles in the penis that are responsible for the second phase of erectile function that results in the fully rigid erection necessary for intercourse. Neither set of nerves is visible, even under the magnification commonly used in robotic surgery. And although the autonomic nerves are located in two bundles on the backside of the prostate and in a thin layer of tissue on the sides of the prostate, the location of the somatic nerves varies significantly from patient to patient, and even from side to side in the same patient. When surgeons perform a nerve-sparing prostatectomy, they peel off the thin layer of tissue on the sides of the prostate. Although this procedure preserves the autonomic nerves involved in the initial phase of erectile function, it frequently does not preserve the somatic nerves, responsible for the second phase of erectile function and urinary control. At various points during the procedure, these invisible and delicate somatic nerves may be damaged due to cauterizing, cutting, or stretching. The ProPep nerve monitoring system allows surgeons to locate these invisible somatic nerves in real time throughout the surgical procedure, providing the instantaneous information they need to potentially reduce unintended damage to these nerves during the procedure. To locate one of the sets of nerves responsible for urinary control, the surgeon places the recording electrodes into the levator ani muscle. Tissue is then stimulated with the surgeon's bipolar surgical instrument along the presumed nerve pathway. When the bipolar instrument is on the nerve, this waveform appears in the system's visual display. The surgeon then knows exactly where the nerve is and what tissue needs to be selectively preserved. After the dissection of the tissue near the nerves, the electrodes are moved to the external urethral sphincter so the surgeon can identify a second set of at-risk nerves that also play an important role in urinary control and are the nerves responsible for the second phase of erectile function. As before, the surgeon identifies where these nerves are and then knows what tissue needs to be preserved. The ProPep nerve monitoring system is fast, accurate, and easy to use. It employs nerve monitoring technology that has been standard of care in spine, facial, and orthopedic surgery for over 20 years. It works seamlessly with the Da Vinci surgical system, and it identifies the somatic nerves responsible for erectile function and urinary control not routinely preserved during nerve-sparing prostatectomies. Ask your surgeon if he uses the ProPep nerve monitoring system. technology that has been standard of care in spine, facial, and orthopedic surgery for over 20 years. It works seamlessly with the Da Vinci surgical system, and it identifies the somatic nerves responsible for erectile function and urinary control not routinely preserved during nerve-sparing prostatectomies. Ask your surgeon if he uses the ProPep nerve monitoring system.